let's talk about sort of the financial component, because insurance, we could do a whole episode on that and its issues and things like that. But what about people who truly are like, maybe they don't have the extra cash, maybe they do for like a one-time visit or something to get at least put in the right direction, you know? What do you suggest for someone who really wants to dive into this, but you know, their resources are limited?
We'll say this because I don't want to confuse people. We do take insurance. We take most major insurance carriers and things. So we are a hybrid clinic of we're cash and out of network. And I would say you really have to think of this. So a perfect example, a patient I'm dealing with now that is having all these IBS symptoms, rheumatoid symptoms, cardiac issues. I put her in touch with my functional medicine doctor that I use personally now, Dr. Fate, who's been on the podcast before. And, you know, it is a cash-based service and it is more expensive than you just going to your primary care and getting, you know, your $25 copay and your 7 to 15 minutes with a doctor. Now, I went into this appointment with her, with the functional medicine doctor. There's a physical therapist with her, advocating for her. There's the doctor that I know and trust. And we spent an hour and a half together talking about her case, all her findings, what I found clinically relevant, this and that. Right. And so he had some findings that were like, okay, like these are things no one's looked at. These are glaring issues. Let's fix them. Here's the game plan. She came back next week. I was like, hey, did you start the gut protocol that he wanted to do? I don't know. It's really expensive. She's like, I don't have a lot of money right now. I was like, hey, you, because of everything that's been going on, haven't been able to work as much. You've cut your workload down to like 10% of what it was. You're suffering every day. Like, what is the cost of you continuing the cycle of poor health or medical management and you not taking care of things? Like, this is an investment, and either way, we're going to learn, like, this either works for you and it gets you better and gets you towards where you want to go with your goals. Maybe it doesn't, but then we know that doesn't work.